Hello everyone, hope so all of you are fine and welcome to my channel. In the previous video we have discussed about mechanical sport. We have discussed about basic introduction of mechanical sport. Then we have discussed about two types of mechanical sports, that were cardiac sport and respiratory sport, and then we have discussed further types of cardiac sport and respiratory sport. Now we will discuss about cardiac sport. Cardiac sport has further two types, that is intra-aortic balloon pump and ventricular assist device. So the main topic of our today's discussion is intra-aortic balloon pump and ventricular assist device. First of all, we will discuss about intra-aortic balloon pump. Intra-aortic balloon pump is a type of cardiac sport. Pump means it will narrow down the area. It will narrow down the wide area and remove the blockage. Intra-aortic balloon pump is a sausage-shaped balloon. It is inserted through femoral artery, means it is inserted through the region of thigh, because femoral artery is present in the region of thigh or leg. Then intra-aortic balloon pump is brought to the descending aorta level. In bedridden patients, it is triggered with the ECG leads, means intra-aortic balloon pump is triggered with the ECG leads attached to the bedridden patients. When the ventricular systole phase comes in the ECG phase, balloon deflates, and when the balloon deflates and allows the blood to pass through it, and when the ventricular systole phase ends, balloon inflates and the process is continued. Let me revise. Intra-aortic balloon pump is a sausage-shaped balloon. It is inserted through femoral artery, means to the region of thigh or leg, and then it is brought to the level of descending aorta. Intra-aortic balloon pump is attached or triggered by the ECG leads that are attached to the bedridden patients. When the ventricular systole phase comes during ECG, balloon deflates, and when the ventricular systole phase ends, balloon inflates. Now we will discuss about indications of intra-aortic balloon pump. There are four indications of intra-aortic balloon pump. Number 1, cardiogenic shock. Number 2, weaning from cardiopulmonary bypass. Number 3, unstable angina. And number 4, stabilization of patient with acute mitral regurgitation. Weaning from cardiopulmonary bypass means if we have used intra-aortic balloon pump during the cardiopulmonary bypass, then we will not remove the intra-aortic balloon pump suddenly, because if we will remove the device suddenly, the patient will not become stable and his body will collapse and he will die. So to prevent this, we use the process of weaning. In the process of weaning, we first of all reduce the amount, pressure and volume slowly, and slowly the lungs adapt and the process continues. Now we will discuss about complications of intra-aortic balloon pump. There are three complications of intra-aortic balloon pump. Major invasive device means it is inserted through skin, through femoral artery. That's why it is major invasive device. Dissection of aorta can occur during insertion, and if the aorta is damaged, then internal bleeding can occur. Air embolism. Air embolism means we are using balloon and the balloon contains helium gas, and if the balloon bursts, that air will goes in blood, and then this air will goes in brain and can cause brain death. This process is known as air embolism, and this is very dangerous for the patient. Now we will discuss about second type of cardiac sport, that is ventricular assist device. Ventricular assist device, its name is showing that it will assist the work of ventricles. What is the function of what is the work of ventricles? The function of the ventricles is to contract. After contraction, from right ventricle blood is pumped into lungs, and from left ventricle blood is pumped into body. If for a time being the ventricles are not functioning properly, then we will assist the ventricles by applying ventricular assist device, so that the blood is pumped from right ventricle to lungs and from left ventricle to the body, and the patient may alive. Now we will discuss about indications of ventricular assist device. Indications of ventricular assist device is that failure to vein from cardiopulmonary bypass, means if the patient has used intra-aortic balloon pump during cardiopulmonary bypass and there is a failure to vein from intra-aortic balloon pump, then we will use ventricular assist device. Bridging to heart transplantation. As you people know that when the heart is transplanted from one patient to another, the time period during which the patient heart is transplanted, the body needs blood, and the patient will die if the blood is not properly supplied to the body during this time period. So during the time period of exchange of heart, we use ventricular assist device so the patient may alive and the blood is pumped to the body. That was all about our today's lecture. Thank you for watching my video. If you have any question or queries, you can ask in the comment section.